And welcome once again to the Lancet podcast. I hope you've noticed that you're getting 2 podcasts from the Lancet this week. That really is value for money. In this podcast, I'm going to be talking in a moment to our guest, Professor Majid Ezzati. He is leading author of a paper published in the April 2nd issue of the Lancet, and this is looking at something very topical. It concerns global health, but it also concerns body mass index, specifically looking longitudinally at trends in global body weight, patterns and changes therein, with enormous implications for health and public health globally. Let's hear from Professor Ezzati introducing himself.
Majid Ezzati, and I'm a professor of global environmental health at Imperial College London.
Professor Ezzati, you're the main author of a truly enormous, if you pardon the pun, study that the Lancet is publishing concerning the weight of the world. This is looking longitudinally at a body mass index in many regions and countries across the world and changing trends in body mass index, which is fascinating. But before we come to the detail, tell us about the collaboration, the group that you've been working with to pull this research together.
This paper is the result of the collaborative group's work. The group is called Non-Communicable Disease Risk Factor Collaboration, or NCD Risk, as we call ourselves. And this is a network of over 700 researchers and practitioners in medicine and public health in most of the world's regions, and we work very closely to try to bring together as much of the data as possible on major risk factors and determinants of chronic diseases. It works as a network and as a collaboration, and it works quite well. And as a result of it, we are able to actually bring more data to this scene than ever done before.
And what was the main objective of this current analysis, and how are you hoping to inform policy? Because we'll come to the implications later on. A lot of policy implications when we talk about population health, population weight in this case, and body mass index, lifestyle factors, health risk factors. Tell us about the aims and where you see it going.
We wanted to understand the trajectory of body weight, and in the specific case of body mass index, and its distribution around the world. We wanted to happen what's happened at the very low end, people who are undernourished and underweight, and what's happening to the high end of this, but not just obesity at severe obesity and morbid obesity. And of course, both at the low end and at the high end, we need to know what's happening in detail to be able to both plan prevention, but also to plan health services for these. So there is there is a difference between if obese people are merely sort of moderately obese to being severely and morbidly obese, and we wanted to know the whole thing, and we wanted to know it for as long as possible. Therefore, we brought, again, as much data as one could imagine around the world together to answer the question at that fine level of detail.
Absolutely. And I think we'll say, for the sake of the podcast, in terms of the methodology, the detail is in the paper, and I urge everyone to look at the paper. But let's focus on the results. I mean, the main thing to say here is that you're able to look back, aren't you, and look at the trends from 40 years ago concerning worldwide body weight trends, averages. What are the top line findings as to where we are in the world compared with where we were 40 years ago? I guess it's no surprise that we're talking about an increase in body weight. That's not news. We've known this for some time. But tell us the top line finding.
Sure. I mean, you're right. We looked at this for 40 years, which is longer than anybody has ever been able to do it because of, again, the nature of data we could bring together. I think the very top line news is that the world as a whole is getting heavier, and it's getting heavier by about 1.5 kilograms per decade on average for both men and women. But I actually think that what's perhaps relevant is just one level finer than that. So without getting into too many of the details, is that actually the rate of decline, the rate of increase in body mass index, it seems to be since sort of around maybe the turn of the millennium, or sort of maybe a few years before or after it, it's a slowing down in the high income countries and for women in some middle income regions. But actually, in other parts of the world, there is just no sign of slowdown, and arguably, body weight has gone up even a bit faster in the past sort of decade and a half than it had before it. So I think that is the other part of it is really this decoupling of the world, that through a lot that was done in understanding the so-called obesity epidemic in the 1990s in the high-income world, and some of the first policy and public sort of attempts to address this happened around the year 2000. There seems to be a little bit of an effect, but not in the low and middle income world.
Okay, so focusing on a little bit of the detail, because obviously the world is a big place and averages are sometimes not terribly helpful. What would be of great interest is to know what are the changes, what are the most significant changes that have happened since 1975, the starting point of your analysis in terms of looking back. Which areas, which countries have seen the most dramatic change in body mass index in the past 40 years?
So some of the smallest increases, which are also interesting, have happened among women in some high-income countries. So this includes places like Japan and some of the European countries, Czech Republic, Belgium, France, Switzerland. So largely in southern, but also some Central European countries have had very small increases in BMI, and I think it's as important to understand why those have happened as it is the high end.
Can we just mention briefly sex differences, because obviously you've done analysis across the sexes and also longitudinally for men and for women as well. What are the most striking findings from your analysis concerning any specific sex differences that are worth highlighting?
There are indeed interesting differences between men and women. So I think I'll mention a couple of them. One is that in general, actually, body weight and body mass index vary more across women in the world than they do among men. There are more countries, and these are again some of the Southern European high-income countries or places like Japan, that's actually more likely for women to not have gained weight and to actually be sort of closer to what one might consider a healthy body weight. Whereas in those countries, men actually have higher body weight. And then there are other places, and this would be places from the Pacific Islands, Middle East, North Africa, perhaps Caribbean. It's actually more likely for women to actually have a higher BMI, so be even more extreme, and these are really high places. So I think that's sort of one of the major differences, more variation across the world. The other thing is that in 1975, especially in places that were undernourished, it was actually more likely for men to have high body weight. And if we want to sort of put an interpretation on this, we would say that if food was hard to get, and people actually weren't getting enough calories, it seemed to be more likely to be going to men. Whereas now, actually, the only place that men have a higher BMI is parts of Europe and high-income world. So again, those are the places that women have gained less than men. Everywhere else, women have actually been gaining more weight over time than men.
That is interesting. And globally, again, the global average is probably not terribly helpful, but actually the BMI average globally is very similar between men and women, isn't it, around 24?
It is very similar between them, and the global gain has been about the same. And again, sort of the two sides of this countering of where it has happened.
We must talk about underweight, because the world is obsessing about becoming overweight, increasing body weight, overweight, BMI 25 to 30, obesity over BMI of 30. But we mustn't forget that there are still vast parts of the population in certain areas of the world where underweight, when poor nutrition and underweight is still a real problem. And that hasn't really shifted, has it?
Underweight has gone down globally, but not as much as obesity has gone up. So there is actually more of a polarization, both within some countries and globally, in terms of underweight to obesity and severe obesity. And there are still places. South Asia is the highest one of this, and then following that are Central and East Africa, where underweight remains quite important. So places like India and Bangladesh, a quarter of women are actually still underweight, and this has implications for pregnancy outcomes, for the mothers themselves and for the children, for mortality from a number of conditions. The numbers are lower, sort of around 12 to 15% for Central and East Africa, but that's still quite high, one of every 6 or 7 people being undernourished. Obviously, there are a couple of implications. One is that, as you mentioned, we don't want to just be talking about obesity. These are probably the poorest of the poor, and their health issues should get attention. Their health is at risk because of being underweight. At the same time, we should just make sure that our social and health policies, and a part of this is around poverty, a part of it is around how people get access to food and how it's distributed. They solve the underweight problem without actually putting the people who need the extra nutrition on low quality calories. So what we don't want is actually the same people to be eating a lot of highly processed carbohydrates, but rather actually creating the social and the food and social, economic and the food conditions that it goes to a healthier food transition.
Absolutely. Which brings us to the final question. Can you remind us, we do have global targets, don't we, for body weight? What are the targets? And there are targets for 2025. Is that right?
That's right. So there is a target that is agreed on by the WHO member states, and the target is that by 2025, after adjusting for age changes over time, obesity is no higher in 2025 than it was in 2010, and that's obviously that was ambitious when it was set. It was a good thing to set it, as it is. Very few countries are even remotely on track to get there. The world as a whole has very little chance of getting there. But the hope is that the very existence of that target will actually create and motivate policies that will make it more likely to achieve it.
And how do you want this report to be adopted? How do you see it being taken up? Because there are so many implications arising from this analysis of the world's weight, the weight of the world. Where next for this report? We don't want it to be put on a shelf. It's got to have life, hasn't it? There's got to be action taken.
In some sense, I think that the nicest thing would be that if within a few years this report becomes irrelevant in the sense that each country does its own really high quality and detailed surveillance. And the global pictures are good because they compare countries, and we should do them every once in a while. But I think what we really would want is for this to go to the country level, for countries to keep track of things, and together with it actually to start experimenting with policies, to start seeing that why is it that Switzerland in the high income world has had little gains, and in the middle income world there might be other countries that have been in that situation, to experiment with policies and to very rigorously evaluate it. For that to be done, it really needs to become country-owned and get there.
But how can that be achieved? Someone's got to take responsibility. Are we talking about the SDGs, the Sustainable Development Goals?
Well, I think that should be a part of it. But again, my hope is that actually national agencies will start championing this themselves. So in a more decentralized way. At the same time, there will be a sort of if you wish, a global picture to do the comparisons and to do the benchmarking. And certainly our collaboration, will be active in this area. It's functioned well and work together with SDGs and other partners. But again, I think sort of, purely country level work will be quite a good thing.
Very interesting talking to you. Plenty more details in the paper. Some fantastic appendices in the paper as well, with very specific country specific information there concerning body weight, and details at a website too, where you can actually get individual country details. Is that right?
Absolutely. You can go to our website, www.ncdrisk, that's ncdrisc.org, and there will be a lot of details, and there'll be dynamic visualizations to actually look at things.
Professor Majid Ezzati, many thanks indeed for talking to the Lancet.
Thanks, Richard. Thank you. It's always good to talk to the Lancet.